Hello, I'm Travis Riker, and welcome to the 2014 Benefits Open Enrollment. I'd like to take a few minutes before open enrollment period starts to fill you in on the changes to your health benefits for the coming year. Remember, employee benefits play a large part in a family's overall financial planning, so it's important to understand them. One of the most important places to spend your financial dollars is on health insurance. Your state health benefit plans have some important changes to take note of. This information can all be found on your Employee Benefits Center. So let's get started. Beginning January 1st, 2014, your health insurance will be provided by Blue Cross Blue Shield of Georgia. Express Scripts was selected as the pharmacy provider, and Healthways is the new wellness provider. Blue Cross Blue Shield has an extensive network of doctors and other healthcare providers. In fact, there was a 97% match in comparing network accessibility to the current insurance companies. Also, as with the current plans, referrals are not required to see a specialist. There are no pre-existing conditions, and disease management programs are still available. The TRICARE supplement will continue to be available as an alternative option to the Blue Cross Blue Shield plan for eligible retired military. Keep in mind, the UHC and Cigna plans will end on December 31st, 2013. However, if you are presently receiving or anticipate you will receive treatment for certain covered services beyond 2013 and the provider is not in the Blue Cross Blue Shield network, be sure to contact Blue Cross Blue Shield no later than December 31st, 2013 to receive transition of care services. This year, you will have 3 plans to choose from: Bronze, Silver, and Gold. They are all part of the Blue Choice Open Access Point of Service Network, providing both in and out-of-network benefits. Each of the plans provide the same coverage, such as doctor visits, outpatient and inpatient hospital care, emergency coverage, and preventive care. The difference in the 3 plans is found in the deductibles, coinsurance levels, and out-of-pocket limits. Coverage for prescriptions is the same for each of the plans, and there are no deductibles that have to be met. Only a coinsurance amount for each prescription filled. All 3 plans have a health reimbursement account, also known as an HRA. Some of you who currently participate in one of the HRA plans are familiar with this benefit. The HRA is funded by state health and is designed to help you reduce your out-of-pocket expenses, such as your deductible or pharmacy expenses. An HRA is like free money for you to use to go to the doctor for any out-of-pocket monies. These HRA credits are payable towards the first expense you incur. For those of you who are on the HMO, this is a new way to think about how your health insurance plan works. You will pay for all expenses up to the deductible limit, but these expenses can be offset by the HRA credits you may earn. There is a base HRA credit with each plan. Depending on which plan you choose, the initial HRA contribution is different. We'll come back to the HRA credit in a moment. But first, let's take a closer look at the differences between the 3 health plans. The Bronze plan has the highest deductible and out-of-pocket limit compared to the other plans, but with the lowest cost to you. After meeting your deductible, the plan will pay 75% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100%. Don't forget that your deductible and pharmacy benefits can be reduced with the HRA contribution. The Silver plan has a lower deductible and out-of-pocket limit than the Bronze plan. However, you will note that the premium cost to participate in this plan is higher than the Bronze. After meeting your deductible, the plan will pay 80% of covered in-network medical charges, up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. This plan also has a higher contribution to the HRA account. The Gold plan, as you guessed it, is the highest premium cost option. It offers the largest HRA contribution, the lowest deductible, and the lowest out-of-pocket limit. After meeting the deductible, the plan pays 85% of in-network covered medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. Don't forget that coverage for prescriptions is the same for each of the plans. There are no deductibles that have to be met. While HRA credits are used for pharmacy expenses do not apply to the deductible or annual out-of-pocket limits. A mail order benefit is also available. State Health Benefit Plan did a very good job of designing the medical plans to help schools comply with the Affordable Care Act. However, these plans are still very different than what you may have today. Let's take a few moments and look at some examples that may help you decide which plan is best for you. While every individual situation is unique, let's assume there are 3 types of healthcare users: low, medium, and high. A low user may look something like this. You see a primary care doctor once, have 1 outpatient hospitalization, and take 1 prescription each month, which in this case falls under Tier 1. A medium user looks something like this. You see a primary care doctor twice. You also see a specialist twice, have 1 outpatient hospitalization, and take 2 prescriptions each month, 1 under Tier 1 and 1 under Tier 2. A high user may look something like this. You see a primary care doctor twice, a specialist 4 times, and have both 1 outpatient and 1 inpatient hospitalization, as well as take 3 prescriptions each month. Now ask yourself, which one of these best fits your situation? Let's walk through how each of your benefit plans, bronze, silver, and gold, fit into each of these situations. First, let's look at the low user that incurs about $2,100 in expenses. Some of that is paid by the insurance company, and some is paid by you. You also pay premiums each year for your insurance coverage. But what's really important to you is your total out-of-pocket cost, which is $1,500, reflected here. And keep in mind that already takes into account your base HRA credit. If we look at the silver plan, your total out-of-pocket cost is about $1,900. And then the gold plan is almost $2,400. Now let's look at a medium user that incurs $6,400 in expenses. Again, some of that is paid by the insurance company and some is paid by you. And once again, you will also continue to pay premiums each year for your insurance coverage. Your total out-of-pocket cost under the bronze plan is just under $4,000. Under the silver plan, it's just over $4,000, as well as the gold plan, again, just over $4,000. Lastly, let's look at a high user that incurs just under $27,000 of expenses. However, keep in mind that only a small percentage of individuals will spend this much in a given year. Your total out-of-pocket cost under the bronze plan is just under $8,900. With the silver plan, it's just under $8,300, and the gold plan about $7,700. While many will find the bronze plan to be the best value, those individuals that have higher healthcare costs may want to consider the silver and gold plans. Let's talk about wellness. By participating in the 2014 Healthways Wellness Incentives, you'll have an opportunity to earn even more HRA credits for your plan. The wellness incentives can, in total, add another $480 to your plan's initial HRA credit. And if your spouse is enrolled and participates, another $480. Here's how it works. Step 1, assess your health. Complete a confidential, online well-being assessment, similar to the health risk assessment in the past. It takes about 20 minutes. And step 2, know your numbers. Complete an annual biometric screening at your participating doctor's office or at State Health sponsored screening event. Complete both and earn 240 HRA dollars. Step 3, you can accumulate another 240 HRA dollars in $40 increments when you take action. You choose between 2 coaching sessions completed over the phone or track certain well-being activities online, or a combination of the 2. More information will be provided in 2014 regarding Take Action incentives. So again, that's up to an additional $480 for you and any covered spouse if you both complete these incentives. Also, if you and your spouse both complete the wellness requirements in 2013, $240 each will be added to your HRA account starting January 1st. You will not lose any unused HRA dollars. Any unused HRA credits from prior years will roll over into your HRA account for 2014 in March. Every employee currently enrolled is required to visit the State Health website and elect a new plan for 2014. The website will be available beginning October 21st through November 8th. Remember to print and keep a copy of your confirmation page for your records when you complete your online enrollment. and also that you will not be able to change your coverage during 2014 unless you have a qualifying event. If you are enrolled in the State Health Benefit Plan and you choose not to elect a new plan for 2014, you will automatically be defaulted into the plan with the lowest premium, which in this case is the Bronze Plan. If you had a tobacco surcharge, it would also apply. For those who enroll in the health plan, Blue Cross Blue Shield will mail ID cards by mid-December. There will be an ID card for every family member, and the card will serve as the medical, pharmacy, and wellness ID. The state health plan offers health care coverage that is affordable based on employee wages and meets the minimum benefit requirements as they relate to the Affordable Care Act. So government assistance on the federal exchanges may not be available to you. You can choose to decline to enroll in one of the state health plans and choose a plan on the federal exchange. But consider that if you do, you will be responsible for the total cost of the coverage you buy. And the cost for coverage cannot be deducted from your paycheck. More information can be found on your State Health Employee Decision Guide, available through your Employee Benefits Center. There you can find more details on what is changing and what effect those changes will have on benefits, options, and rates before making an election this upcoming year. Remember, our job is to help you get the most efficient use of your benefit dollars. We appreciate all you do and thank you for spending valuable time with us. Have a great open enrollment. Take care.